I didn't know I was having a stroke, is the answer. This was my third event in terms of strokes and TIAs, and I was literally just standing, talking, and I think I best describe it as coming over all unnecessary. There was a tingling in my face, there was nausea and general unwellness. And I just wanted to go to a room and be by myself. Fortunately, my son was with me, and he said, "Oh no, you're not right. I'm taking you to the doctors." And I said, "No, no, 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 no." And I think I'm one of amongst many people. When they're unwell and somebody says you must go and see a doctor, the first response is in the negative. You don't want to do it. Certainly, you don't want to go to A&E where you feel a bit of a fraud. But I did go to the doctors, and the doctor interviewed me, and by that time I was aware that things weren't right because I was beginning to feel more unwell. My speech was beginning to fail, and I was beginning to feel a weakness in my left-hand side. The doctor arranged for an ambulance to come and get me. And I was then admitted into the A&E here at the Royal Berks, by which time things had got worse, and I found it very difficult to communicate, but above all I was scared, to be honest with you. I was really quite scared of what was going on because I didn't know. One of the things about having a stroke is you can be aware of exactly what's going on around you, but you are powerless to do anything about it because communication is very difficult, and the confusion that you're feeling, which is obviously the stroke kicking in as things start failing in your head, is, as I say, it's just a very, very worrying thing. It can also make you quite angry. I was getting cross with myself, not with anybody that was around me because they were brilliant, but I was getting cross with myself because I felt the failure to communicate was my fault. And had it not been for the fact that my wife came with me, I wouldn't have been able to communicate with the medical staff at all.
In Steve's case, we had a call from the GP discussing symptoms to see whether he was suitable for a clinic, in fact. But the person taking the call, who was the ward manager of the stroke unit, quickly recognised that this might be something that we could treat straight away. So she suggested the patient come in by 999 ambulance. Consequently, we got the alert in the normal way, and myself and a colleague were waiting for Steve when he arrived. When he got to us, he was slightly confused a bit. He appeared not really to know what all the fuss was about and why was he here. And indeed, his symptoms were not the usual stroke symptoms. People expect there to be a weakness of one side, the arm and leg, or the face. And in fact, in Steve's case, he did have a speech problem and some visual disturbance, but it was not a classic stroke picture. However, doing some quite simple but sophisticated testing of him when he first came in, it made it quite clear to my colleague and I that this did appear to be a stroke. Dr. Mossop was also involved. We requested a CT scan, got him round there quickly, and were able then to give him the clot-busting drug. The reason for getting to hospital very quickly is that the treatment could only be given within 4.5 hours of the first symptom. In that time, we have to get a CT scan done. In some cases, there might be patients on particular medication. We might need a blood test back before we can actually give this drug. So the sooner you get to hospital, the better. Also, the quicker the treatment is given, the more likely it is to be effective. Every second counts. Your brain cells are dying off at a rapid rate all the time we're waiting to give this. That's why we respond quickly. You can't give the drug after too long, as it becomes more of a risk to give it. It can cause bleeding in itself by being a big clot buster. So we want to give it as quickly as we can in order to get patients as well as we possibly can.
One of the first things that Dr. Mossop said was, look, I'm going to administer this drug to you. I'd had the scan and there was no bleed or anything like that. So he explained that some of the downsides of having the thrombolysis, which again I understood, but I couldn't say yes or no because I just couldn't say it. So again, it was my wife who could speak for me. She said, yes, do it. So they went ahead with the infusion, and it was a very, very strange feeling because I think it was within about half an hour of having the initial injection, the infusion, which the doctor administers, and then you have this strange pump thing fitted up to you. And I think it was within about half an hour, my speech started coming back, and I began to feel just a lot better within myself, and the fear had all gone, and I knew things were going to get better and I was going to be all right. So obviously it was a great relief. And I think that, again, is part and parcel of the recovery thing. Now, throughout all this, the staff at the A&E had been absolutely brilliant, because one of the things that I know now, but I didn't know then, is that the stroke team were ready and waiting for me when I came in, because there'd been communication between the doctor in Henley and the emergency crew on the ambulance, and so everything was ready. Now, I hadn't been aware of that at all. The other thing is, when you get here, is there is such a degree of professionalism, and they don't mess about. They just get on and decide what they're going to do. I will never know what would have happened had I not had the treatment. Worst case scenario, I wouldn't be sitting here. There are strange times in your lives when you just have to look around you and see how much effort people are putting in and how dedicated they are, and appreciate that. And then it changes your life, because afterwards you just want to do more to help them achieve what they've set out to do. The team here at Reading are just outstanding in what they do, from the major consultants through the nursing staff, and the people that look after you generally on the ward. It's just a magnificent place to be. Not a place you'd want to be, but if you need it, if you are in that condition that you need someone to help you through a stroke, I wouldn't want to be in any other place, to be honest with you.